But the minerals have to be in the soil. The plants have to be healthy enough to uptake them. And then the plants have to be healthy enough to use the minerals to manufacture vitamins. And that's how we get most of our vitamins and minerals. But it all begins in the soil. 6 inches of topsoil is determining life on Earth. So my name is Bonnie Kaplan. I'm a PhD researcher, mostly retired from the Faculty of Medicine at the University of Calgary in Alberta, Canada. During much of my career, I studied the relationship between nutrition and brain health because my training was in physiological psychology as well as neuroscience. I understood that that was a very important topic to understand mental health and also dementia and everything that can go wrong with our brains. We should be always considering nutrition. But because I am retired, I'm usually listed as Emerita or Emeritus, depending on your Latin preferences.
To be clear for anyone that's going to be watching this, we're talking about micronutrients and we're talking about them in supplement format. So this is going to be your vitamins, and this is generally what we're referring to, taking supplemental doses of these micronutrients.
So micronutrients is usually reserved for minerals and vitamins, okay? So aside from vitamins and minerals, what do we need for a healthy brain? We need the essential fatty acids, like the omega-3s. We need amino acids, which are the building blocks of protein. And then there's this other whole gigantic category that we never talk about, which are the phytonutrients that mostly haven't been studied yet. There are thousands of them, but Mother Nature packages them in the plants with the other good things. So we have evolved to need them. They must be doing something in us. But aside from a few like lycopene and resveratrol, they don't have names. We don't know what they do.
Wow.
So we really need to start out by eating better. Any of us who studies micronutrients, we always somewhere slip in the statement, I'm a food first person. And that's the reasons why. Yeah.
Very clear. And then if we aren't doing that, if we aren't getting that, then supplements do work according to all the data that you've seen and research that you've done. I've heard even claims that taking vitamins doesn't work. It gets destroyed in your stomach and you don't get any into your system. That was a big thing going around a few years ago.
Really?
I remember mass media was pushing that hard, and I still run up against that now, that some people walking around thinking that they're useless.
So if our stomach destroyed the nutrients, how would our species have survived?
They think in the pill form. If you're taking pill form of vitamin D, then it's not going to get into your system.
No.
Okay, well, that's good to know.
Yeah.
Thanks for clearing that up.
One of the things I try to do, Jason, is I try to educate people as to how we get nutrients, because people don't know. But the minerals have to be in the soil. The plants have to be healthy enough to uptake them. And then the plants have to be healthy enough to use the minerals to manufacture vitamins. Then we come along, we eat the produce that comes off of those plants, or we eat the animals that have eaten the produce. And that's how we get most of our vitamins and minerals. But it all begins in the soil. 6 inches of topsoil is determining life on Earth. And so if the soil is depleted, and we have very good evidence that in many places it is, then we are not getting the ideal amount of vitamins and minerals in our food.
Amazing. 6 inches of topsoil rules life on this planet. Isn't that an amazing thought? Does the processing of food strip nutrients out as well? Modern processing techniques.
What we are much more aware of is that we, as a people in Western society, are replacing healthy whole foods with ultra-processed foods. And when you do that, you are depleting yourself of what you should be getting the minerals and vitamins that your brain cells need. And the latest data on this are utterly shocking. But 2/3 of the caloric intake of our children in North America, 2/3 is now from ultra-processed rubbish. That means that they have chosen, or we as parents and school systems have chosen, to give them ultra-processed rubbish. I refuse to call it food. It's ultra-processed rubbish to fill their tummies 2/3 of the time. And so they're not consuming the nutrients that are needed in the brain. Our brains need minerals and vitamins because they're cofactors. And my fondest wish is that the word cofactor would be taught in our school systems down at around the maybe grade 5 or 6. Because once you understand that everything that happens in our brain is a metabolic step, which requires enzymes, and that enzymes are dependent upon cofactors to work, then you understand why every single step that we want to be accomplished efficiently in our brains is dependent on what we have put into our mouths, which is now in our bloodstream. So the cofactors are the foundation of enabling our brain cells to talk to each other. They're the foundation of our brain cells being able to synthesize and break down neurotransmitters like serotonin and dopamine and all of that. Cofactors are absolutely vital. They're the foundation of how our brain works. Yeah, especially when a physician says to me, and it used to happen a lot when I was still in my office at the university, says to me, there's no proof that nutrients affect mental health. I immediately understand that what they're saying is, I have not looked for the proof. I have not read the proof because I know it's out there. I mean, just on the multi-nutrient formulas, or we call them broad spectrum formulas that have roughly 15 vitamins and 15 minerals that were developed here in Alberta, there are over 50 peer-reviewed studies. Many of them are fully blinded, randomized, controlled clinical trials. But the media never covers this research, and that's why those of us who have done it like to talk about it, to try to educate the public.
So that is an actual stance, something that you'll hear from doctors, that they dismiss. We're talking about supplementing with nutrients here, right? They don't dismiss the idea that nutrients are valuable just when we're talking about supplementing, right?
That's right. I sometimes refer to 1950s dietitians as having done a lot of harm. They really brought a whole generation of us, and I include myself in this, to believe that as long as we ate a balanced diet, dearie, you'll be fine. But the reality is that there's very, very good evidence showing that the things that we've been doing to the soil have depleted the soil of an awful lot of the dietary minerals.
Bonnie, by imposing massive fees and costly compliance demands on manufacturers, the government will drive up consumer prices. Why would that be good? And the really strange thing is this: haven't you shown cost savings for healthcare as a result of micronutrient treatment? Isn't it a win-win?
Yeah, a number of us have published articles that evaluated the cost of savings to governments when people take micronutrients for certain kinds of problems. So I think the oldest article is a very, very lengthy long-term follow-up case report of a child in Alberta who had childhood psychosis, which is very, very hard to treat. And he was an inpatient at the Alberta Children's Hospital. They tried, to their credit, I think they did a good job of trying every medication known to deal with his hallucinations and delusions, and they were quite bizarre, but they were unable to control them. And so then they sent him home to be cared for by the family. And the family had heard about one of the broad spectrum micronutrient formulas. So they called me, because my name had been in the press, and said, would you help us ask our psychiatrist for permission to take minerals and vitamins and to see if that will help our son? Isn't that kind of strange, but
Hmm.
that's where we were then. They were afraid of alienating the psychiatrist. Well, the psychiatrist turned out to be a wonderful person who ended up becoming an integrative psychiatrist. And we studied the child as he went on to the micronutrients. He was now off of medication. And then we got a health economist involved who pulled the healthcare data on this child and comparing the 6 months at Children's Hospital to the immediate following 6 months at home. Of course, there were no inpatient costs, but taking no medication, getting better on micronutrients, and the cost was less than 5%. I mean, we saved 95% of his healthcare bill. And now this is a young man now who I've been following since 2008. And we can't prove it because we don't have the tests for it, but he obviously has a congenital need for an unusual amount of micronutrients to keep his brain functioning properly. Because since 2008, he still has to take the micronutrient formula. His family still has to pay for it because there are no alternatives. But he's not psychotic. I mean, that's a big deal. So, and we saved 95% of the healthcare bill on that child over the years.
Wow.
Just in the 6-month comparison, we saved 95%. And then we followed that up with a woman where two health economists at University of Toronto helped me pull the data on her. She had been in BC, Ontario, and Alberta. And we showed very similarly, it was costing about $60,000 a year for her outpatient costs for her bipolar disorder. And that was brought down to less than $800, which she has to pay for when she moved to micronutrients. And we published the data showing that she became well and also the cost savings.
There are studies, you said 50 or 100?
If you look only at the broad spectrum formulas that were developed here in Alberta from True Hope and Hardy Nutritionals, there are about 50, 55 peer-reviewed studies. They're not all placebo-controlled trials, but they're various stages of levels of research. If you then add in the research showing, for example, the VitaCog trial at Oxford University in the UK that showed that high-dose B vitamins slowed down cognitive decline and reduced actual dementia in a senior population. That was a fully blinded randomized trial with T scans or MRIs, I guess, showing slowing of brain atrophy, the whole bit. I mean, excellent research. So there are also all the studies on dementia. There are studies on the omega-3s. There are a whole lot of other studies. So I think that I could easily put together another 50. And especially if you include all the epidemiological data. I mean, there are at least a dozen really large population-based studies that show that people who eat a diet that's better, meaning whole foods as opposed to ultra-processed rubbish, are less likely to have depression and anxiety symptoms. And people who eat more of the ultra-processed stuff have more symptoms of depression and anxiety. And these come from Asia, they come from the UK, they come from Spain, every country. It's just very strong. So I could easily put together all 100 that I'm referring to and show you that the evidence is vast. And if people ever say to you that there isn't much evidence that nutrients really help with your brain health, just tell them it's out there, but you haven't looked.
I will tell them. Thank you very much, Dr. Kaplan, for joining us.
It's my pleasure. Thanks for having me.